We will all die with some plaque in our arteries. The key is to make sure that that plaque doesn't grow so big that it blocks off the artery and it doesn't rupture and create an acute problem like heart attack, stroke, or losing a limb. So I will take an ultrasound and look at the arteries in the neck and see, is there early thickening or is there soft plaque in there, and try to stop it. The thing that sets off this cascade of forming plaque in the artery is there is way more that you can do on your own than any pill I can give you, any supplement, any procedure. There is always hope. There is always a path forward. Even if we are just 1% better tomorrow than we are today, that is better, and we will take it. It is never too late to work on stabilizing that plaque and living a beautiful, healthy rest of your life.
Dr. Lillie Johnston, could you just give some background as to who you are for people who may not be as familiar with you?
Absolutely. I am classically trained as a vascular surgeon, so that means that I treat the arteries and the veins pretty much everywhere in the body. The two exceptions would be in the heart itself. That's the territory of the cardiologists and the cardiac surgeons like Dr. Ovadia, whom you've had before, and also the arteries within the brain or in the skull. That belongs to neurosurgery and the neurospecialists. Everything else in the body, every artery and vein, kind of belongs to me. And as I was starting my career, I was really saddened by the number of patients that were coming to me over and over again with progression of their disease, even though we put in a stent or even though we did a bypass. It felt like there was something more to this whole story, and it's true. Arterial disease is a body-wide problem, and putting in a stent or doing a bypass doesn't fix the underlying disease. It just goes around one area that is narrowed or blocked, but the disease still exists. So I put myself on a mission to put myself out of the surgery business by understanding as much as I could about the nature of this disease and trying to stop it so that people didn't have to have operations and didn't have to keep coming back for more procedures.
Some people have this idea that risk of heart attack and stroke and having damaged arteries is 100% related to genetics. And so are there other things aside from genetics that are playing a role in someone's, let's say, damaged arteries?
So I absolutely have patients who come to me with a genetic predisposition, and those tend to be people who have a family history. Everybody in their dad's side of the family died at 40 of a heart attack or had a heart attack in their 40s. Some people have a genetic predisposition for clotting disorders or autoimmune diseases. Those types of things actually can be genetic, but there are absolutely lifestyle and, let's say, modifiable risks for this disease, including the obvious one is smoking. Everybody thinks that that's the only one, but it's not. In today's modern era, the big one for us is diabetes and insulin resistance, and the development of damage to the artery wall from repeated exposure to high blood sugar. So that all those things come together and they all result in plaque, but every root cause is a little bit different. And part of what I love about my current way of practicing is that I get to dig deep and find each individual patient's root cause or causes, as the case may be, and try to really nip that in the bud and get back to that root and try to find it and fix it there before people end up with limb loss, heart attack, stroke.
So what percentage of people do you see who are needing help due to genetics or lifestyle?
I would say it's probably 70 to 80% more modifiable lifestyle type risk factors and maybe 20% true bad genetic predisposition. But, there are lots of people who have both. And just because you've been dealt a bad genetic hand doesn't mean that that consequence is inevitable. Specifically, people have familial hypercholesterolemia or lipid cholesterol problems, clotting problems, autoimmune disease. Many of those things can be mitigated with a really dedicated lifestyle effort in terms of nutrition and exercise and sleep and stress management. And all of these things can come together to not only work on those genetic diseases and disorders that people may have, but also the downstream impact of that inflammation, oxidative stress, and arterial damage.
So you said that when you're working with patients, clients, that you can find the root cause for them specifically. Is it genetics? Is it lifestyle? What part of lifestyle? Is it sleep? Is it smoking? Is it food? So is it just a questionnaire you're doing, or how do you go about figuring out the root cause for that individual?
We spend a couple of hours together typically in my initial visit, and we go through area by area: nutrition, exercise and movement, sleep, stress and connection and purpose in life, and toxic exposures. That includes alcohol, nicotine, tobacco, other drug use. And then I also utilize a pretty extensive lab panel. So that covers everything from complete blood count and metabolic panel, fasting insulin, and inflammatory markers, a advanced lipid testing panel, which is just not just the cholesterol, but also our particle counts and sizes, and Lp(a), ApoB. We also talk about hormone health, and that's everything from thyroid to sex hormones, sometimes even obesity-related hormones, leptin, adiponectin, GLP-1 receptor agonists. And then we kind of put that all together and try to understand what's happening, what's going on. For my patients who sometimes don't come to me with a diagnosis of arterial disease, we also can do some imaging. So I will take an ultrasound and look at the arteries in the neck and see, is there early thickening or is there soft plaque in there that we otherwise wouldn't know about? And that can also inform how aggressively do we manage. So cholesterol is the classic example, right? Lots of people in the space are like, LDL cholesterol is a terrible marker. We should never pay attention to it. And if you have no plaque and no thickening in your arteries, I completely agree, right? By itself, it's okay for some people. We know some people walk around with an elevated ApoB or LDL-C, and it doesn't seem to hurt them. There are other people who walk around with a relatively unremarkable level, but also have plaque. And at that point, we have a conversation, risks and benefits. How would you like to approach this? What makes the most sense for you? But really looking at the arteries and whether that's a CAC or a CIMT or coronary angiography, CCTA.
And are these things covered by insurance, or is this a pay out of pocket, and how much do these things cost?
It's generally not covered by insurance. Some people can get reimbursement on the back end. But if you're not having symptoms and you're just interested in looking at your preventive risks, then CAC is the most affordable. That tends to be somewhere between $90 to $150 out of pocket. And there are lots of states in which you can order that yourself and go get that, kind of walk in off the street and have it done at a local imaging center. It is a CT scan with no dye, but a little bit of radiation. Next on the list is CIMT, or carotid intimal medial thickness. That is what I typically offer in my practice because I like looking at the vessels myself and being able to have that conversation in real time with my patients. It's also the least invasive. There's no radiation involved. We can repeat it annually. The key with CIMT is to make sure you are getting it done through a very reliable and accredited lab. The downside to ultrasound is that it is very operator dependent. CIMT is anywhere from $150 to $400, depending on your market and who's doing it and where the lab is. The final option is sort of the Cadillac, is the coronary CT angiography, CCTA. And most people are now doing this with an AI imaging overlay. So the images are submitted to a software package. Clearly and HeartFlow are the two biggest competitors in that space right now. And then you get this very fancy, very pretty analysis of all of the coronary blood vessels, where there is soft plaque, where there is hard plaque, how narrowed any of them are, what your total plaque burden is. And it's this very, very in-depth analysis. But it's more expensive, and that it runs cash anywhere from, I think, about $1,300 to about $2,000, again, depending on your market. Some places you might be able to get the CT portion covered with insurance, AI overlay, probably maybe not. And there's a little more radiation and there is some contrast dye, but it's probably the most comprehensive look at the blood vessels and the different types of plaque, how much there is, exactly how narrowed things are.
And have you had any of those tests run yourself? on your
I
side?
have not yet had a CAC or a CCTA, but I have had my CIMT done.
And how was it?
It looked pretty good. My arterial age was 10 years younger than my chronologic age, and I did not have any plaque.
Perfect. So what are you eating? We want to know what you do.
Absolutely. And I am very happy to share. And
there's a part 2 to this conversation, as so many of you guys say that a 50-minute long video is quite long. So I shrunk this interview into 2 parts. And the second part to this conversation, I'll have Dr. Lillie finish the answer to that question, as the second part is going to be all about what she personally does, the things that she eats, the 3 things that she avoids as a vascular surgeon to make sure that she has clean, beautiful arteries, and the simple habits and things she does to prevent risk of heart attacks. So stay tuned for that. Make sure to subscribe. And then while we're here, if you ever experience headaches, leg cramps, heart palpitations, muscle cramping, fatigue, low energy, and you feel overall dehydrated, then check out Element Electrolytes, who is today's video sponsor. They've got really clean electrolytes with no artificial food dyes, no colors, no high fructose corn syrup, and they have the science-backed ratios of sodium, potassium, and magnesium that can help our cells stay more hydrated and can help our heart health. I personally have been drinking Element for several years now. I just rip open a packet, throw it in my water or milk, even my yogurt. I put it in avocados sometimes, and it's just a really convenient packet that you can take with you to work, take it traveling, where you can just add that mixture into some water to get those essential minerals we need for our hydration. You can get 8 free packets of Element's most popular flavors with any order using the link in the video description or by going to drinkelement.com/Lillie Kane. They also offer a money-back guarantee. So if you try it and you don't like it, you can get your money back. And I think there's a lot of people who still may have the idea that saturated fat clogs arteries and leads to heart attacks. And so what are some common misconceptions that people still may believe related to heart attacks and their arteries?
Again, everybody responds a little differently. So I will say that I have some general principles for people, and I am always data driven, and we always measure. What happens to my lipid panel may not happen to everybody else's. So that's food for future thought. But it is not this idea that all the fat we eat is like pouring hot liquid grease down your drain. This is not that, but that's been the story for 50 years or more, now maybe 70 years. We have taught people that fat is what clogs arteries because when you pour bacon grease down your drain, it clogs your sink drain, and it makes total sense to people in their brain. But we have really now come to a place where we have evidence that suggests that eating dietary cholesterol, so eggs and shellfish tend to be the big components in that category for people who are eating whole foods. Dietary cholesterol does not seem to do much for your serum cholesterol measurements. So we don't care about that anymore. Saturated fat is the other one that gets a lot of attention. There have been many studies that show that there is some relationship between your cholesterol levels, but not necessarily to cardiac events. Now, there are some people who do not do well on a very low carbohydrate diet. I have a very close friend of mine who does not do well, very low carb. And for those people, reducing fats and going up on unprocessed whole food-based carbohydrates tends to work better for them. There are people who reverse diabetes using that approach.
Sure.
So I believe proteins are our building blocks, right? They are what structurally we need to have muscle and bone and skin and hair and nails. Carbohydrates and fats are our energy supply. And we tend to do better if we run on predominantly one of those 2 fuel sources. And if you're gonna run predominantly on carbs, please make sure that they are whole and minimally processed whole foods, right? Doritos and Twinkies are not a great solution for a high carb, low fat diet. And I have had vegan clients and patients who, were eating vegan trash and they're like, why am I not healthy? Why do I have PCOS? Why do I have all these problems with my mood and my skin? Yes, right. We can do any of these diets poorly, or we can do them well. And again, I think we all know what really that is. But long story short, I do well on a low carbohydrate approach. Most of my patients, that's what I offer first, because I do think for patients with severe insulin resistance, diabetes, typically reducing carbohydrates and going up on good fats works well for them. And the truth is, if you look at cardiovascular risk markers, almost everybody does better, even with low carbohydrates and higher fats. Virta Health put out this study, and if you look at the whole patient, their triglycerides get better. Their HDL cholesterol goes up, which is better. Their blood pressure comes down, which is better. Most people's LDL cholesterol does not go through the roof. Now, some people's does, but you can measure that and you can test. But not everybody, for sure not everybody. And some people actually get better. And if you measure the particle counts, sometimes you get a reduction in particle count, meaning the particles are getting larger, less atherogenic or less likely to form plaque, but the overall LDL-C number, cholesterol number, stays the same. So we can get improvements in our total cardiovascular risk, and it's about more than just that LDL-C number. So it's relevant, I think about it, and in some patients, I will actually offer treatment for it, but it's not the whole picture. And saturated fat is not the demon that we made it out to be. And if you feel better not eating it, great. We don't have to.
So if saturated fat and red meat aren't the biggest drivers for clogging arteries, what is? You had mentioned insulin resistance and diabetes can be a factor, but what exactly does that mean? What are people doing? What are people eating that leads to them having damage with their arteries?
The thing that sets off this cascade of forming plaque in the artery is inflammation and oxidative stress. Think of this like a forest fire. Like the trees are the cholesterol. There is always cholesterol in a plaque. There is always a forest involved in a forest fire. But is it the forest's fault that it was on fire? Like, do you blame the trees? They're relevant, right? You cannot have a forest fire without a forest. And it's probably not the fault of the trees. So what sets off that spark? Is it lightning? Is it a campfire? Is it some spark that, several rocks collided and a spark ignited? Who knows? But in the body, lots of different things will ignite that spark. So some people have autoimmune disease and they are inflamed. That inflammation comes from their autoimmune disease, and that is the spark that sets things off. But excess sugar floating around in the bloodstream will also damage the very sensitive inner lining of our blood vessel called the endothelium. And if that is damaged, plaque will begin to form. Plaque is an adaptive response to injury. Just like stress is an adaptive response, our body trying to keep us alive from an attack, but chronically, it's a bad thing. So acutely, it's a good thing. Chronically, it's a bad thing. I think plaque is the same issue. This is all an adaptive response to small micro injuries that we will all get. We will all die with some plaque in our arteries. The key is to make sure that that plaque doesn't grow so big that it blocks off the artery, or it doesn't rupture and create an acute problem like heart attack, stroke, or losing a limb. So absolutely, tobacco, nicotine will damage the wall of that blood vessel, and presence of excess sugar in the bloodstream will also damage the artery wall and allow blood to form. Both of those things also create an environment where the blood vessel itself doesn't stretch or relax as much. Therefore, the blood pressure, each beat to beat cycle, creates a little bit more damage to the artery because it's stiff now. Some people have a blood clotting disorder. They may form more plaque because of that. So trying to step back for each individual and understand what in them is feeding this fire and how do we tamp that down is, in my opinion, much more satisfying than just putting a stent in it and hoping it doesn't come back, or bypassing around it and waiting for that fire to get the brand new blood vessel we just put in there. There is way more that you as my client can do on your own than any pill I can give you, any supplement, any procedure. And it starts with the boring everyday stuff: nutrition, exercise and movement, sleep quality, stress accommodation or risk reduction, right? Stress will happen to all of us, but how we manage it, how we increase our capacity to deal with life's stresses is important. And those toxic exposures. And the truth is, not everybody who smokes will get a heart attack from plaque or get lung cancer. We know that. Not everybody who drinks too much will have a problem or become metabolically unwell, but many will. And if you are passionate about building your health retirement account so that you can have all the great late decades to go dancing and go traveling the world and go hike the pyramids, whatever it is for you, then yeah, you got to kind of be a little less fun, right? You have to like drink a little less and eat a little better and move a little more and prioritize your sleep when you can and come up with a way to manage your everyday stress so that it does not get the better of us. And it's boring and it's everyday and it's banal, but it's important. And if I have any message, it's really that stuff matters and it moves the needle much more than anything I as a doctor can do in terms of medication or supplements or operations procedures.
And do you help people with getting off of the ultra processed foods? Because I feel like for a lot of people, that's kind of a staple nowadays in the American diet. And so to get off of the pizza, the chips, the brownies, the donuts, that's the hardest thing for a lot of people because it's just such a habit. It's everybody's having it. It's a fun thing and it's a way to relax, to relieve stress. So do you help people with getting off of those things, and what strategies, or if you don't help people with that one-on-one, what strategies would you offer for people to get off of those things?
Well, I actually will turn this back on you in a minute here because I think you probably have more experience with this than I do, and I want to know what your tricks are. But yes, of course, I will help people try to do that when they come to me and say, I am ready to change my nutritional approach. For some of my patients, the hardest thing is actually not so much like the stuff in bags and boxes in the grocery store. That's a little bit of it that they can get away with, but it's actually restaurants because they are in sales and they have to have all these client dinners, or they're in advertising and they keep having to meet people out for drinks and for appetizers. And again, in terms of our sources of fats and what is processed about all of those foods, like many of those things are actually hurting people in the long run as well. And so I offer them an opportunity to say, my doctor says I am going to fast, or I can only have a bite of this, and otherwise I am on a different approach for my health. Sometimes all they need is an excuse so that they don't look lame in front of their friends and their clients. The like keto substitutes or the low carb substitutes, the lower carb tortillas and the Ezekiel bread, some of that stuff can be helpful. I try to use it as a transition tool, not as a destination. But again, every choice that's better is better than Wonder Bread, is a step in the right direction, and meeting people where they are, trying to know what they are ready for. And I honestly believe as they begin to feel better, then they begin to want to make those better choices. And it's a process and it evolves with people over time, and just building the trust and the encouragement and the compassion for them on that journey is, I think, probably what helps the most. But what do you think?
That's all really great. I think for me, the easiest thing is to tell people to focus on their protein, because inevitably they end up eating less sugar because the protein fills them up so much. So often if you were to tell someone, hey, just stop eating sugar, that's not going to be helpful, because they're like, well, what else do I eat? And also it just sounds so lame. And so instead being like, hey, we're going to focus on protein first, whatever that means for you. If that means you're going to order a salad, it's going to have chicken on top, or it's going to have shrimp on top. Or when you go out to that restaurant, make sure you eat your steak first and you can have the potatoes and the dessert on the side afterwards, but you have to finish that protein. So I think when people focus on the protein first, that will inevitably help them eat less sugar. I think that a lot of people are eating these things for some reason, obviously, right? So either it's from stress or from not being prepared. Maybe they ran out of time, so they're on their way home and they're like, I'm gonna go grab fast food, or I'm just gonna have the microwavable meal because I didn't already meal prep ahead of time, knowing that I'm not gonna have the energy to wanna make dinner when I get home. I think that there's different versions of ourselves throughout the day. So we got motivated Lillie in the morning, who she's gonna do the meditation, she's going to do her exercise. But if you come evening Lillie, forget about it. Don't talk to me. I just wanna chill. So knowing that about yourself and that there's different versions of you, we wanna lean into the motivated morning Lillie and have her do the meal prepping and have her go grocery shopping. So that way we can let her check out come evening time. And so I think that if people were to make a list every time, let's say they ended up having the cookie, that's fine, but I have to write it down in my cell phone or on a notepad. Why did I do it? I did it because I was hungry. Oh, okay, well, great. Next time we're gonna eat more food at breakfast. I did it because I was in a social situation and I didn't bring anything. Next time I have to bring something to the event, or I have to eat beforehand. maybe I reached for the cookie and I ate it because I was stressed. Great. Can I take a walk? Can I call a friend? So if you keep a list, you'd end up seeing, oh, my list says stressed, stressed, bored, stressed, unprepared, stressed, stressed. Great. We don't need to work on getting sugar out of your diet. We need to work on your stress levels and finding that other thing to cope, because often people are using food to help push down that feeling. And so we need to release that feeling. Okay, cool. Let's go run on the treadmill. Let's go punch a pillow, whatever that is for you to release that energy out there versus I think, yeah, people are reacting. I think a lot of our society is go, 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 so busy that we are just, I'm feeling this feeling, like react, versus having the tools in place to be able to know, oh, I'm having that feeling. What am I going to do about it? I pause, I reflect, I give myself the 20-minute rule, meaning I can have the cookie, but in 20 minutes. And therefore it gives you the time and space to be like, okay, why am I really doing this? Oh, okay. Refocus.
Those are such great points. And I love that point about emphasizing protein. I have also found that to be true in my patients as well. Some people cannot react, they don't react well to restriction of any kind. But the minute you reframe it as do more of, get more protein, then it becomes super accessible. They have no resistance to that. And you've not forbidden them from anything, right? You just say, we get that protein in first. And I have also found that to be a very, very powerful strategy for helping people get the nutrition that they need and then make better choices later. Even if they have a cookie, maybe it's 1 instead of 4, right? Yeah. Because they had that protein, they have now more satiety, and hunger is less likely to be one of those many reasons. And you've also done a great job addressing those emotional components, because especially for the highly stressed CEO of the house, some of us will just have used food as our drug for a long time. We don't smoke, we don't drink much, but food is our reward for having done all the things and adulted so well all day long. And finding other ways to honor that day and the stress and, our feelings in the evening is really, really key.
And for people right now, if they're listening to this and they go, oh, for years now or for decades, I've been doing the wrong thing. I probably have plaque in my arteries. Is there hope for that person? Is there still a way for them to slow down the damage or reverse any damage that they may have already kind of done to their body?
There is always hope. There is always a path forward. Even if we are just 1% better tomorrow than we are today, that is better, and we will take it. So I help people reverse their plaque when it's early and also stabilize whatever may already be there, either from years of thinking Snackwell's cookies were the right choice and listening to everybody who said, get rid of all the fat in your diet, whether it's genetic predisposition, whatever the case may be, it is never too late to work on stabilizing that plaque and living a beautiful, healthy rest of your life.
Awesome. And so I guess just to reiterate again, I think we've already touched on it, but I like to give people an action step. I'm like, do this today. So for someone listening right now, what is something they can do today that can start cleaning out their arteries, reversing insulin resistance, and putting them on a good track?
I'm going to give people 2 things because I think this is that important. The first thing is just go outside for a walk. Do it for 5 minutes, but everybody can do that today. You can do it in your bare feet if you don't have shoes, but everybody can take 5 minutes and just go outside and look around and come back. So that's what you can do today. The second thing I want everybody to do is have an idea of your cardiovascular status. So whether that means booking a CAC or finding somebody in your area who can do an ultrasound of your carotid arteries and the CIMT, or getting that CT angiogram, even just making an appointment with your primary care doctor for the first time in 5 years and getting your labs done. Do something proactive today to evaluate your health and hopefully especially your arteries. I am excited to be launching CoreSight Health, which is going to be my personal cardiometabolic practice. Stay tuned for that website. In the meantime, people can find me at vascularhealthinstitute.org, or I am on socials at Lillie Johnston, MD.
Dr. Lillie and I mentioned finding the healthier swaps to the foods that you love. And so I went to the grocery store and I found the healthiest versions of pizza, tortillas, breads, pasta, chips, ice cream, chocolate, soda, and more. And I made a short video with those healthy swaps. I'll link it right here and in the video description. And again, stay tuned for part 2 with Dr. Lillie. Don't be silly, subscribe to this Lillie, and I'll see you in the next one.